Hey, it's Ev, and this is a video about scans and health screening for trans men and AFAB non-binary people. So I'm going to be talking about things from my perspective as someone in the UK using the NHS. Some of this information might still be relevant if you're not in the UK, but your country might have different guidance and policies. I'm going to be giving you some information that I found online, which I'll link below, and also some helpful videos. And also I'm going to be talking about my own experience and my future plans. So first of all, I'm going to talk about what screening you will automatically be invited for, depending on if you're registered as female or as male with your GP. And I'm going to do a whole separate video about this, but basically a lot of people think you can't change what gender you're registered at your GP as, but you absolutely can. You don't need to be diagnosed, you don't need to have had lower surgery, you don't need to be on hormones. You can change your title, your name and your gender. You should just request and they should do it, and I'll leave a link about that. If they're refusing to do it, I would suggest show them an NHS website, which I'll link one below, because they can't really argue with that if they're with the NHS and they're saying it's against NHS policy, because it's definitely not. So looking at the gov.uk website, if you're a trans man or non-binary assigned female at birth, and you're registered with your GP as female, you will be invited for breast screening, bowel cancer screening, cervical screening, which is also known as a smear test, but you're not invited for AAA screening. But if you're registered with your GP as male, then you are not routinely invited for breast screening, but you can request it. You are invited for bowel cancer screening, you are not routinely invited for cervical screening, but you can request it. And you are invited for AAA screening, but you don't actually have a high risk of that. And usually it's if you fit within the age range of people that are invited for those screenings, so it might be that you're younger than that age range and so you won't be invited anyway. In this video I'm going to be focusing on the breast screening and smear test or cervical screening, and also I'm going to be talking about getting a scan if you've been on testosterone for a certain number of years. So I'll talk about that one first. On the London GIC website, it says, one of the medical reasons we refer people for hysterectomies is the risk of endometrial hyperplasia, which is increased if someone's been taking testosterone for 2 years and more. If someone does not wish to have a hysterectomy, or presumably if you do wish to have one, like me, but you have to wait for years, then it's advised that you have an ultrasound test every 2 years to monitor the risk. I've actually had this ultrasound twice. The first time, I think, was before I was 2 years on T, maybe after, but it was because I was having some cramps and basically felt like period pain, but I wasn't bleeding. First of all, they made me do an STI test, even though I wasn't having sex, and then they sent me for a scan and it all looked fine. And then the second time was because I'd been on T for quite a few years. That was quite recently, and I went and had another one, and that was all fine as well. First time, I think it was done at like a doctor's surgery, and then the second time is at a hospital. You have to go in with a full bladder, which both times I honestly did not drink that much. I had like half a small bottle of water, and both times they said, wow, you do have a full bladder, which it didn't feel full, but whatever, it worked out. And it was an external scan, meaning they like put the thing on your stomach, they didn't go inside, but both times at the end they did offer and say that I don't have to do it, but they have to offer if I want to have the internal one. It can give a better picture for them to like examine, and I said no, and they were completely fine with it. Before my first one, Dr. Seal actually told me eventually when I have to be having these scans that I should just make it clear that I want an external one, not an internal one, if I'm not comfortable with that. I know there are cases where the external one doesn't work, but I think most of the time it does. I saw Alex Bertie's video, which I'll link. He said that the external one didn't work, and they... Hi, so I've watched Alex Bertie's video again, and I've realised he didn't say that the external one didn't work. He said that from the beginning they told him that he should do both, or that they should do both, and that he agreed. And after talking to some other people, I found out that some clinics and hospitals sort of urge you to do the internal one because, like I think I mentioned, it can give a clearer image for them to examine, but you're never going to be forced to do it. And I do stick to the same advice that I originally gave, that if getting the internal one would be so traumatic and difficult for you that you'd end up staying home and not having anything done, then definitely still go and just get the external one where they just rub the thing on your belly. It's not that that one is bad and useless, it's still very helpful and beneficial to get done, otherwise they wouldn't do it at all. It's just that the internal one can be used as well to get a clearer image for them to examine. They're really not going to force you, and you could even say that you don't want to do this now and you want to book another appointment because you're not prepared for it. Even with the external one, if you want them to stop, they'll stop and get off you. However, if you do feel able to get the internal one, then, like I said, it can give them a clearer image to examine. So if you're able to get that, then go ahead and get it. I'm not telling anyone not to get it, I'm just saying there is the option and they're not going to force you, and it's best to have one than to have none at all. Personally, I might consider going and getting the internal one if I still have cramps, which I am still having, because, like I mentioned, I'm going to have to go and get a smear test done anyway. But if I'm going and getting that done, then I might as well go and get the other thing done, because if I can handle it, then I might as well. But yeah, the main thing I was trying to say is just, in my experience, I've never been pressured into having the internal one where they go inside. They've always been fine just doing the external one, and Dr. Seal said that if I wanted to do just the external one, I can say that, which is what happened. And yeah, they're not going to force you. I had to do an internal one, but if you're absolutely dead against getting an internal one, it would be better to just go and try the external one than just stay home and not have anything. And usually that does work, so you might as well try. When I went and it was in a hospital, I did have to go to a waiting room, which I think was only for women, and the receptionist, because I spoke to someone as I went into the hospital, and then I went upstairs. It was a huge hospital, and there was another receptionist, and she did call me miss, but I had a mask on, and then I think that area was for those kind of scans and a women focused area, so I didn't really mind. Eventually she saw my name and I guess figured it out. Both the people that did the scans were really nice and understanding and made me feel comfortable. It really didn't feel like that much of a big deal. And now I still get bad cramps, but at least I know that it's likely not that. They didn't find anything wrong with me, so at least I have peace of mind. So the breast screening is for all individuals aged 50 to their 71st birthday. Who are registered as female, you'll automatically be invited for one. But if you're not registered as female and you haven't had top surgery, you can still request it and go and get it done. Also, if you find any lumps or anything, then you can just go to your GP and get it checked out. I have a few times. I have one hard lump, which I think came just after my top surgery, and it's still there. It's been there for years, but she said it's a spot. So I just have a spot on my chest that's been there for years. Now the cervical screening, which is what they call the smear test, is for once you hit 25, which I did a few days ago. On 2nd of May I turned 25, so soon I'll have to be going and getting one of those, and it says every 3 years. As I'm registered as male, I won't automatically be invited for one, but my doctor is aware that I'm trans and has mentioned it to me. You might have a doctor that's really good and will remember and tell you about it, or you might have to just think for yourself and make sure you mention it and ask for one. Fox Fisher did a really good video about getting his done, which I'll also link below. He actually sort of made a vlog about it happening, and he went to a special trans-friendly place. I think it was called Clinic T. Let me check. Yeah, he went to Clinic T in Brighton. There's also a place in London that does the same thing. Yeah, Dean Street in London do cervical screening, and that's a trans-friendly specialist clinic. The NHS site says that most cervical screening is done in a GP surgery by a female nurse or doctor, but in some parts of England you might be able to go to a local sexual health clinic instead. Now there are LGBT specific sexual health clinics that specialise in LGBT people, which obviously includes trans people, so maybe if your local area has one of those you might be able to go there. Or you can just go to your local GP practice. When I looked online, the Birmingham LGBT Centre seemed like they used to do, like, they used to have like a trans clinic that did that, but now I can't really find any recent information about that, so I don't think it's a thing anymore. If I can't find anywhere more local that's like specifically LGBT friendly, then I'll probably just go to my GP practice. I was hoping that by now, turning 25, I'd be either very close to having a hysterectomy and lower surgery, or I would have already had it, but I haven't, and I'm not close to having either, so yeah, I'm going to have to go and get a smear test, which I won't enjoy, but it's best to do it anyway, and I'll probably make a video about it as well to try and help anyone else. So yeah, I can't really give my experience of what that is actually like because I haven't had it done yet, but I will do in the future. I did read that the actual test itself only takes around 5 minutes and that a whole appointment can just be like up to 15 minutes, which sounds like it should just be over quick, and it's worth doing every few years to make sure that you're healthy. So all the health screening that you would need, depending on what body parts you have, you do still have access to as a trans person. It's just that depending on what you're registered as, you might not automatically be given a letter about it. You might have to remind your doctor and ask about it. And your GP absolutely can still change your gender on the system and change your title and your name. And doing that, they might say, oh, we can't do that because then we're not allowed to give you a smear test. That's not true. You can change your gender with your GP before you've had lower surgery, before you've had a hysterectomy, before you've gone to a GIC. You definitely can. And like I said, if they're refusing, just show them an NHS website that says that they should be doing it, that I'll link below. And yeah, I'll make a more in-depth video all about that. So yeah, thanks for watching. If you have any questions, then leave them down below.